Good evening. Welcome to Today Interview Time. Today we have Dr. Gottfried Hirnschall, Director of Department of HIV and Global Hepatitis Program at the World Health Organization in our studio. World Health Organization proposed the Mongolian Ministry of Health to host the global event to commemorate World Hepatitis Day 2018 and raise awareness of viral hepatitis. This year's World Hepatitis Day theme is Test, Treat, Hepatitis. World Hepatitis Day was celebrated on 27th of July 2018 with a press conference and public events including meetings between the government of Mongolia and WHO. Good evening, sir, and welcome to Mongolia. Thank you for receiving our invitation and coming to our studio. Let's just directly start talking about hepatitis. What is hepatitis? Well, from the medical point and for our audience, not from the scientific, difficult language.
I try to sort of explain it just as I would explain it to a layperson, maybe. It's a viral disease. It's an infectious disease.
Infectious.
And it is a disease that primarily affects the liver. That's why it's hepatitis. So it causes damage to the liver. Usually that takes quite a number of years until that occurs. And it can cause liver cirrhosis or liver cancer. And as we know, both of these conditions are very serious conditions. And as I said, it's infectious, so it is can be transmitted primarily through blood.
Through blood.
Through blood. It can be transmitted from the mother to the child. It can also be transmitted through sexual transmission. It can be transmitted through needle sticks. And that can happen in a hospital, in a doctor's clinic, through an injection. But also it can happen, which is what we don't see so much in Mongolia, but we see in many other countries, by injecting drug use.
Injecting drug
users. Persons who inject drugs, share the needle, which is still very common in some places where not sufficient clean needles are available, and that's where infection occurs.
Okay, there's a hepatitis B, C, and if I'm not mistaken, D, Delta, right? What are the origins of these viruses?
Well, there's actually more than the three you mentioned. There's A, B, C, and E.
E, okay.
Right.
One more.
But the ones, and that's what we are going to talk about tonight as well, and that's what we are focusing on during World Hepatitis Day events, is hepatitis B and hepatitis C. C is in Charlie. Because these are the two forms that are the most serious forms, that also are the ones who produce the most serious liver conditions and contribute to the mortality, meaning the people dying, to the greatest extent. And talking about people dying, there's about 1.3 million people dying due to the consequences of hepatitis in a given year.
Around the globe.
Around the globe.
What's the situation when it comes to the treatment and prevention around the globe?
Right. I just want to give you one more figure. I mentioned the 1.3 million people dying. There's 325 million people, a third of a billion people, in other words, who actually have chronic hepatitis B or C. And these are people that have a high risk of advancing to those conditions that I mentioned, cirrhosis,
cancer. Cirrhosis.
So that's the bad news, but we also have good news.
Oh yes,
and
I want to hear that.
We now have ways of diagnosing somebody who has hepatitis B or C, and we also have ways of treating or even curing somebody for hepatitis C. We have a treatment for hepatitis B, which is something that it's a bit comparable again to HIV. You have to take it lifelong. Not everybody has to take it, but those who have to take it lifelong. For hepatitis C, it's really, we have some revolutionary, relatively new drugs that were basically developed just a few years ago, 3-4 years ago, that can cure completely hepatitis C and eliminate the virus completely from the body. They need to be taken 3 months, up to 3 months, 8 to 12 weeks. orally. So
8 to 12 weeks.
8 to 12 weeks only. Orally, it's a tablet that you have to take every day. And it's something that has very limited...
And who has innovated it?
Who has developed it?
Yeah, in what country, or where was it developed?
Quite a lot of that was developed in the United States. But it's now, there's not just one medicine now. We have actually a whole range of different medicines that can be combined in different ways. And even generic companies are now producing them. That means those medicines that used to be very expensive to start with have become quite cheap. You know, the first drug, when it became available, sofosbuvir originally, it cost $84,000 for this 3 months treatment.
Wow,
so that's a lot, because you know the way the companies justify that, for partly good reasons, is that they had to make some major investments. I still think it was a very expensive drug, but now it can be as cheap as $200 to $300 for the full cure.
Wow.
Not in all countries, but in many of the sort of lower middle income countries, the costs have come down considerably, including here in Mongolia. So that's really what I think it is a central part of the conversation that we are having around World Hepatitis Day. And that was also discussed at the events yesterday here in Mongolia.
I want to talk about hepatitis, the virus B. And I think there is some connection when we go to the doctor, the Delta virus comes up. So what's all this about? Let
me start with some good news. We have a vaccine for B that can protect us from B. Vaccination, immunization that can protect us. And can also protect a baby that is born possibly to a mother that has hepatitis B. And the best way of giving the baby that injection, that vaccine, is within the 21st hour after the baby is born. This vaccination has been introduced on a broad scale in most parts of the world. And we have seen really a major decrease in new infections due to hepatitis B. It's a real, what we call a public health success story. Because you know, we used to have many more infections. Now with this good vaccine that is more and more used, we see very little. In some parts of Africa, there is still a long way to go, because that early dose, birth dose as we call it, is still not yet delivered. But for example, in Asia, China, Mongolia, your own country, we have seen that new infections have really gone down. So that's the story with B, and then we have the treatment, and then we also have, you mentioned D, there may be a combination, a super infection as we can call it, with another virus D that is not very well, where we don't know so much about yet, and where we don't have a treatment and cure yet for D as well. But there's a lot of research going on and quite some investments to develop something for D as well.
Can you tell our audience about the Healthy Liver program, which was initiated by the Mongolian government?
Well, I maybe not the best person to talk about the Mongolian program, but I do certainly know a little bit about it. We had some very good meetings with the minister and her team earlier this week in the lead up to the World Hepatitis Day events. It's really, this program is really the expression of an incredibly important commitment that the government has made here in Mongolia to say we are a country where we have a high burden of hepatitis B and C. Estimated that probably 10% and more of the adult population actually is chronically infected. But many of these people still don't know that they are. Some do because they get sick. But a lot of the people who are still in that phase where they don't feel sick, but they are infected, they wouldn't know. So the commitment of the government was to say, we really need to get everybody tested, and everybody who needs treatment or the cure needs to access that very quickly. So they started that program, I think in May 2017, and within a year, the program was able to get more than 350,000 people tested.
350,000
within 1 year.
Well, for Mongolian population, that's a good number, isn't it?
I think you are 3 million.
Yeah,
so
we are 3 million.
So and we, also as WHO, consider this a very good success for now, and really a strong step in the absolutely right direction. Because obviously many more people still need to be tested. The next target that the minister has communicated, I think, is 1.8 million people that will be tested in the next phase now, between now and 2020. But obviously we have seen already something happening that points towards a successful program.
Well, because we just mentioned the good side of the government initiation and all that, but what are we lacking? You know, the good criticism is good for development for us, for Mongolians. So where are we lacking effort, or what do we need more?
Well, what do we
need to accelerate?
What the government will need to do now is obviously living up to those very ambitious targets that have been set for the next phase. And to get 1.8 million people into testing is a major exercise. And the way I understand Mongolia, you have more than, I guess, 1.5 million people living in Ulaanbaatar.
Yes.
But the other 1.5 million is probably not so easy to find. So you have to really get this out into the national health facilities, probably also in the private sector, in private clinics, so that really everybody, not just those people who have easy access, but really everybody who needs testing, who needs treatment, can get it. The other piece that I learned also from the Mongolian program is that there's a very novel approach to financing this. The drugs, as I said, have become cheaper, but they cost a few $100s. And there is now a scheme that has been put in place where the government plays a fairly large proportion, I believe 60% or so, through the health insurance scheme, which is good. The patient still has to pay the rest, the 40%, but and I think that is a fair mechanism, and that's something that we've from WHO characterized as something, again, very positive. However, one thing I would like to say, some people may not have that money to pay for that.
Yes.
And I think it will have to be, that sort of flexibility will have to be built in the system, and maybe it's already there, that those people who can't pay will still get the treatment. So for us, from WHO side, this whole notion of nobody should be left behind, it needs to be universal access, and universal really has to be universal, is absolutely important.
This is where the private sector's role is coming in.
Absolutely.
What are the best practices of raising the role of private sector into prevention or treatment of the hepatitis?
The role of the private sector, I think we have the private health sector, to give a few examples, where private doctors obviously come into play, private clinics, where really they also have an important role. They also need to be aware, and they also need to follow the same direction.
They need to contribute.
They need to contribute.
To the public.
Absolutely.
Yes.
So I think that's a very important point. And
how do we raise their goal?
Well, I think
they rose.
Yeah. Well, I think it is the government that will have to reach out to the private.
Force them.
I don't think anybody can be forced in the private world. And in some countries, maybe. I don't think in Mongolia. But I think it needs to be certainly discussed through professional organizations, associations of physicians, etc., to really make sure that there's some sort of consistency in the way people are treated, and also that they also play their role. But private sector, more broadly speaking, every employer wants to have his or her workforce healthy.
Yes.
So I think there's also the role to share information in your business. It is really the role also to make sure that your staff, your employees, they know that testing is available, and even sometimes it could be made available through testing services within the health services in a large company, for example. We have seen this in other countries quite a bit. So I think that's where the corporate sector comes in. This is where the private sector comes in to really help with the messaging, to really help creating a demand, and to really encourage their staff to seek the best services they can to actually learn their status again and access testing and access treatment in case they need that.
Well, this is all about raising awareness.
Absolutely.
Doesn't matter government or the private sector, the clinics, doesn't matter. Raising awareness to let them know we all have to be healthy, live healthy. Right.
And I would assume in a country like Mongolia, hepatitis is so common that probably most everybody knows somebody who has hepatitis or has a case in the family or in the extended family. So that type of awareness, I'm sure, is there. But I think it now needs to get also, it's the awareness about what to do, really, to also take away the fear, because I'm sure there's some people who still fear to know their diagnosis and who may want to delay rather than proactively say, finding out my status is actually an opportunity to now access treatment and stay healthy. And I think that's the positive spin and that's the positive messaging that is so important, and that's where we all can play a role.
We cannot obviously skip the prevention part. How can one prevent himself or herself from the hepatitis?
Well, I already mentioned
the vaccination.
The vaccination, obviously. I think in many countries, and I understand also in Mongolia to some extent, there's a little bit of pharmacy, meaning there's maybe too many injections that are given. And sometimes maybe in the past, probably has improved with possibly not clean needles or unsafe needles or shared needles. So absolutely avoid that. And also, I think testing in itself is prevention, because by testing you prevent becoming sicker. So that you may already be infected, so then you can treat it, and you find that you're actually not infected. I think that creates also a positive momentum where you feel good about. You can again spread the positive message, carry the message to others.
I got tested, right? And spread the word.
And blood transfusions need to also be screened. They need to also be safe. So that's a role of the government primarily to make sure that blood transfusion are also sufficiently screened. In general, this is what happens much more than it used to be 10, 20 years ago, globally speaking. But that's also obviously a very important issue.
Thank you for coming here and sharing all this information, and even thank you for coming into Mongolia to spread all these messages and good vibration. And I really do hope in a very close future, the humanity eliminates the hepatitis.
Well, certainly that's what we also hope too, and that's what the WHO, the World Health Organization, is working towards and is working with countries to move in this direction. I just want to say maybe as a closing message from a personal perspective, I think hepatitis, or more broadly speaking, our health is our own responsibility to a large extent.
Yes, exactly.
So let us do what we know we can do about it. Again, some of the things that we discussed, testing, I think in a country like Mongolia is absolutely important that everybody finds out his or her status. But I also want to give you all a message about Mongolia, the country itself. I think you should be very much aware that you have a program that is quite unique in the world, where Mongolia is really a trendsetter or a trailblazer, I would say. And we from WHO side, and I work at the global level, I'm based in Geneva, we very often use the Mongolian example now as a very positive example. We refer to Mongolia as one of our few champion countries, and we hope that this good example will entice many other countries to follow the pace and to do similar good things. So thank you very much.
Well, thank you very much, sir, and I wish you good health and good luck with everything.
Same to you. Thank you very much.
Thank you. That's all for today. Thanks for staying with us. We will see you next Tuesday with more news and updates. Have a good one. Bye-bye.